Today's topic, as you know, is combating anemia, fatigue, and GI side effects through diet. Myeloma treatments, as well as the disease itself, can come with several unwanted side effects, such as anemia, fatigue, and gastrointestinal issues like chronic diarrhea or constipation. How can what we eat play a role in alleviating or managing these side effects? I'm excited to learn with you today from our featured speaker. It's now my pleasure to introduce Stephanie to you. Stephanie Wiese, RDN-CNSC, is an oncology BMT dietitian and has been a member of the CBCI team since 2019. Her previous career was in banking, which she left in 2016 to pursue her passion for nutrition, and she became a registered dietitian. She loves being a part of her patients' journeys and feels strongly that nutrition plays a major role in both treatment and transplant. Stephanie, we're so grateful for your time here today and look forward to hearing from you. The time is now yours.
Thank you so much. Let me share my screen. Okay. Thank you everybody for being here. I really appreciate you coming and taking the time to listen to me speak about all of these really important things. As Audrey said, I have been a dietitian for 3 years. I've worked at Colorado Blood Cancer Institute in Denver for 3 years, and I absolutely love it. I love the patient population that I get to work with. I love just walking with people through their cancer journey and really providing them with evidence-based information while they're going through treatment, after treatment, before treatment, because it's so important. There's so much information out there right now. If we type in something to Google, I mean, 1,000 different opinions from 1,000 different people come up. And so I like to kind of walk through that with people and honor people's food preferences and choices, while also just providing them with the evidence and the science behind some of these claims. So with that being said, I will go ahead and start. Here's just a general overview about some of the things that we're going to be talking about. So gastrointestinal side effects, anemia, fatigue, and then we'll open it up for some Q&A, and hopefully I'll be able to answer questions for you guys. And, feel free to also provide feedback if you were looking for something else, or you think the information could have been presented differently or anything like that. I'm always open to feedback. I love presenting. I love teaching classes, and I always ask for feedback because I think that's super important, getting your opinions from the other side of it. So first of all, let's talk about some of the GI side effects that come with, it can come with chemotherapy. It can come from some of the medications you're on. But most of the GI side effects that I see are caused by chemotherapy and radiation. Some of them can be caused by diet. Emotional stress or anxiety. I think this one really gets underestimated. What happens to our GI tract when we are experiencing emotional distress or anxiety? Inflammation of the intestinal mucosa. So this one's huge. So my patients that are currently getting treatment, chemotherapy is targeting rapidly dividing cancer cells, and our GI tract from our mouth to our anus is lined with those rapidly dividing cells. So it's also going to affect those and cause some inflammation. So that can be another reason why you're experiencing those side effects. Certain medications, a lot of the medications, when you look on the bottle, the side effects are going to be nausea, vomiting, diarrhea, GI upset, discomfort, bloating, cramping, all of those types of things. Lactose intolerance, that can sometimes develop as a consequence of treatment. Lactose is a little bit harder for our bellies to digest. So that can come, I've had people that just steer clear of dairy while they're getting active treatment. And it's not a bad thing to take a break if you're noticing some constant GI upset after you're ingesting dairy. And it's not uncommon. Infections, that could be E. coli, that could be any sort of bacterial or viral infection can cause GI upset, and then malabsorption. And that can happen if you're having chronic diarrhea, or sometimes if things are going on with your pancreas or other organs, and you're just not breaking down and digesting food like you normally would. So I'm just going to talk about the two most common ones that I see, and just some of the recommendations that I typically use for my patients that tend to work. So the first one being nausea and vomiting. So some of the nutrition interventions that we would recommend is really adhering and paying attention to your antiemetic regimen, and the timing of it. So if you are taking Zofran or Kytril or Compazine, and you can take it every 4 or 6 hours, making sure you're saying, okay, I'm gonna eat in an hour. So I know I should probably be taking something right now to kind of prime my GI tract, and calm that down. And just kind of always be thinking of that, having, mealtime sometimes planned out, or no, okay, I know I'm going to eat every 2 or 3 hours today. So I'm really going to try to stay on top of that. Eating smaller and more frequent meals. You'll see this. I recommend it all the time. And I know it sounds a lot easier than it is. And we'll kind of go through some of that in a little bit, because I have some snack or small meal ideas to keep on hand. But really, when you're nauseous, it could be because your stomach is empty. It could also be because you are taking medications on an empty stomach. It could also be because you ate a really big meal that your body is having it's just taking a long time to digest. So keeping all those things in mind, sometimes just breaking up your meals into, eating every 2 or 3 hours consistently throughout the day gives your body, your GI tract, the ability to digest and absorb those smaller amounts of food, while at the same time providing you with energy, and giving your belly a buffer when you're taking some of your medication. So keeping something in your stomach. Avoiding high fat or greasy foods. So this is a big one. So if I'm working with a patient that's having just chronic nausea, and just upset stomach, I'm going to recommend that they kind of cut back on that high fat food. And we'll see if that helps at all. But when we're talking about the 3 main macronutrients, which are protein, fat, and carbohydrates, fat takes the longest to digest. Okay. So if that's sitting in our stomach and making our stomach work really hard to digest it, that can sometimes cause nausea. And sometimes that can be said for fiber too, although that I don't like to cut out until I absolutely have to, because fiber is just so good for our bellies. So the first thing that I try to advise cutting back on is high fat or greasy foods. And it doesn't, none of these recommendations have to be lifelong or long-term. It can be until those side effects pass, and then you can start reintroducing fat back into your diet and say, okay, how much can I tolerate? Because sometimes it's just a tolerance issue. Sometimes you can tolerate a little bit of olive oil drizzled on your, salad. Sometimes you can tolerate, a cup of cottage cheese or something like that. You just can't tolerate a whole meal of high fat food. I think I already touched on this, avoiding medications on an empty stomach, and then ginger containing foods. This is an interesting one that doesn't always work, but if it's mild nausea, it will work. It either ginger chews, ginger teas, having, that kind of Asian cooking profile where you're adding ginger to your food, or even pickled ginger. Ginger is just a known natural occurring antiemetic. So a lot of times that can calm your stomach down. If you're wanting to try that first before jumping to the medications, that's always appropriate. Some other considerations I'll recommend, acupuncture bracelets. So I don't know if you guys have ever seen those, but a lot of times pregnant women with morning sickness will wear them, and it touches on a pressure point. Sometimes that can help. Acupuncture, massage, distraction techniques. So some distraction techniques that I recommend are, changing your meal environment. So if you're always eating at the kitchen table, maybe eat lunch outside today. Maybe change your surroundings a little bit so you're not kind of in your same routine. So your brain is kind of focusing on, oh, this is new. This, I'm not in the same environment that I'm in. And that can kind of help with some of the nausea also. And the other most common GI side effect is diarrhea. And this kind of will, I know constipation these can go hand in hand, and I know they can vacillate back and forth. And I know it can be so frustrating. And we see this all the time. So one of the first things, and you guys could do this at home on your own too. You don't have to be working with a dietitian. I always recommend it if you are, really having trouble identifying foods that are causing any sort of GI upset, or if you're, losing a ton of weight and muscle mass. It's always great to work with a dietitian. But if you're having some of these GI side effects, nausea, diarrhea, vomiting, you can kind of do this on your own, what I'm about to talk about. So writing out a detailed food log and saying, okay, at 9 o'clock, I ate cottage cheese and 2 boiled eggs. And then half an hour later, my stomach was really upset. And then a half an hour after that, I had diarrhea that was watery, or however you want to explain it. I never get embarrassed about any sort of bodily fluid, bodily function talk or anything like that. Nothing is off limits in that regard. And then also, I like when patients document the medications that they're taking too in that food log. It just helps identify, okay, I took my antibiotic, and then 30 minutes after that, I had diarrhea. So maybe can we time that differently during the day? Maybe can we, take that with food? I know there are medications that have to be taken on an empty stomach, and there's really no way around that. But some of them, we can work with the timing of your medications, your food, and try to manage those GI side effects. So I usually like a 48-hour food diary or food log, and then have, separate columns for the food and the medications, and then any sort of GI side effects that are happening. And sometimes people write how they're feeling. Maybe it's not a GI side effect. Maybe it's just sluggish. Maybe it's low energy. Maybe it's, something else. But those are really, really helpful when we're trying to track and pinpoint, okay, what is actually causing this? And then what are we going to do about it? So if they're chronic and if you're having them all the time, that can be a really helpful tool. And then sometimes, depending on what that tells us, I will recommend a low fat, low fiber, low lactose diet. And again, avoid gas producing foods. So those usually are beans, cruciferous vegetables, so broccoli, cauliflower, Brussels sprouts, and see if limiting or kind of reducing the amount of any of those foods, if we see an improvement in those symptoms. So again, we're not cutting these foods out long-term because we need fiber in our diet. We really need fiber in our diet. We don't want to cut fat out altogether because we need those healthy fats. And lactose, we don't want to totally cut out either, unless indicated, because it provides lots of good nutrients. So we're just trying to kind of limit the nutrients and the foods that we know that are known to produce some GI side effects, or are just, all these foods are just harder to digest. There's nothing inherently good or bad about anything. And I don't, just a little bit of background, I don't ever label foods good or bad. So we're not talking about cutting any of these out totally forever. It's just, we're trying to give your belly some easy to digest foods. And sometimes these can be the culprit of making your stomach really work to digest and absorb them. Considering bulking agents could be another recommendation if you're having either chronic diarrhea or constipation or vacillating back and forth. So soluble fiber, I like to get fiber through foods, soluble fiber. So think of grains, think of oatmeal, think of bananas, that kind of stuff. So those are going to be soluble fiber. So those are going to draw water into the GI tract and help. It can also help bulk up your stool. So insoluble fiber is like roughage, like the skins of fruits and vegetables and stuff. So that's still important, but we're talking about the other type of fiber, which is soluble fiber here. Avoiding sorbitol or other sugar alcohol containing products. So some of those artificial sweeteners, where there's definitely a place for them. And we know that, you know, if you're dealing with high blood sugar, or you're watching your sugar intake for any reason, there's a time and a place for them. But they sometimes, if they're eaten in a certain quantity, they can cause osmotic diarrhea by sucking too much water into the GI tract. So just paying attention to that. Oh, am I eating a bunch of sugar-free candy, or am I eating a bunch of sugar-free, you know, soda plus bars plus, you know, is it adding up? Are you eating too much of that? And then always ensuring adequate hydration if you're dealing with diarrhea. And really, this is for constipation too. I mean, if you're constipated, adding fluid to your body is going to add fluid to your GI tract, which can help move things along. If you're losing an incredible amount of liquid, if you're having diarrhea, you can consider adding electrolytes to your hydration plan for the day, which there's some great products out there now. You know, it used to only be Gatorade, but there's some really great products out there. Liquid IV is a good one. LMNT is another one that I like. But that's only if you're having really high volume losses. Otherwise, with just water and your diet, you should be okay. Okay, I thought I had a little bit more on that, but so that's all for the GI side effects. So now I will move into talking about combating anemia, which, as I'm sure most of you know, is quite common in blood cancers, blood disorders. So we see it a lot. So we see low blood counts. Anemia specifically, obviously, is low red blood cell count. And so the causes, it can be a lot of different things. Cancer treatments such as chemotherapy, radiation, as well as any cancers or disorders that affect the bone marrow. So that's gonna cause anemia also. And as I said, when you're anemic, your body does not have enough red blood cells, and red blood cells are supplying oxygen from your lungs to the rest of your body. So when you're anemic, you are feeling quite low, quite fatigued. Nothing is really functioning at full capacity. Some of the nutrition recommendations that I give to my patients are increasing iron in your diet. Now, sometimes if your anemia is being caused by chemotherapy, or sometimes even blood cancers or blood disorders, this will not be the only thing that helps what your blood counts recover. But this can definitely be a tool in your toolbox to help that. So increasing iron in your diet. And I always want to make this note that we always advise our patients to avoid taking iron-containing supplements. So I would ask your doctor, your provider, before ever introducing an iron-containing supplement. But iron in your diet and in the food that you eat is digested and absorbed differently than the supplemental form. So this is dietary iron. So this is iron in the food that you're eating. This is not in a multivitamin or supplement of any kind. And I know they add iron to a lot of the protein drinks, and that's the same as this. So that's not like a pill form of iron. So increasing iron from your diet. There are two types of iron. So there's going to be heme and non-heme. Heme is going to be from red meat, poultry, and fish. And then non-heme is going to be beans, lentils, spinach, kale, apricots. There's lots of foods that have non-heme iron. So heme is going to be most readily absorbed in the body. It's going to be easier absorbed. But if you don't eat meat, or you're, plant-based, vegetarian, vegan, you can totally get enough iron from these other sources. So don't fret about that. You just have to kind of be intentional with making sure you know the iron content of the foods that you're eating. So some other tips to increasing iron absorption would be including high vitamin C foods when you're eating an iron-containing food. So vitamin C actually helps the absorption and aids in the absorption of iron. So If you're going to sit down and have a piece of fish, you could have some dark leafy vegetables with it. You could have a baked potato with it. A lot of times, citrus juice, so oranges, grapefruit, which grapefruit is not typically recommended because it interferes with a lot of medication. So I usually just scrap that altogether, but definitely oranges, lemons, putting lemon juice on really anything. I mean, if you want to put it on your fish, your poultry, meat, your beans, I mean, just kind of mixing and matching to make sure you are increasing the absorption of that as much as you can. You can also eat enriched or fortified grain products. So a lot of grain products have iron fortified in them, which is really, really nice for our vegetarian and vegan patients, because then they're still getting that really good dietary iron. Limit coffee and tea intake at meal times so as to not decrease iron absorption. So coffee and tea can actually decrease the absorption of iron. So there's like a 30-minute window before and after meal times that you might, it might benefit you to wait on drinking those because you don't want to interfere with that absorption. And then just a quick note in here that some cereals contain quite a bit of iron per serving, total 100% bran flakes, grape nuts. So even having a 3/4 of a cup of that cereal can ensure your daily iron intake. So I thought that was really interesting. And I always pass that along because you don't have to eat, we don't recommend that you eat red meat every day. We recommend it, once, maybe twice a week. So this is just another source of getting that dietary iron that you need. Another recommendation is to increase B12 in your diet. So B12, the body needs B12 to make healthy red blood cells, even white blood cells and platelets. So increasing this in your diet can also help with anemia. So B12 is found in red meat, fish and shellfish, eggs, dairy products, and then fortified food if vegetarian. So this one's a little bit trickier if you're a vegetarian or vegan. And this one, we see a lot of our patients just taking a B12 supplement if they're not quite getting enough in their diet. And that usually our providers are on top of that and are totally comfortable with B12, taking that supplement in pill form. It's a water soluble vitamin. So whatever you don't use, you will just excrete in your urine. So those are a few ideas on ways to increase B12 in your diet. So let's talk about fatigue. That kind of goes hand in hand with anemia. Causes of fatigue include anemia, inadequate energy and protein intake, so just not eating enough calories, not eating enough protein, weight loss. So if you're actively losing weight, that is going to cause you to be very fatigued. Pain, chronic pain can just wipe you out. Medications, there's a lot of medications that can cause fatigue. Cancer treatments in itself are hard on your body. Your body's expending a lot of extra energy trying to recover and repair your healthy cells during cancer treatment. And so that can just wear your body down too. Dehydration and sleep disturbances. So a lot of time, due to different medications, stress, anxiety, all those things are impacting sleep. So that can be a big part of fatigue also. So some of the nutrition interventions that we recommend are keeping easy to prepare meals and snacks on hand. And I think in the next slide, I have lots of different ideas to just keep in your refrigerator, keep on your counter. Just always having something easy on hand so you are able to fuel your body all day long, eating in those 2 to 3 hour intervals. Having some, calorie dense, protein rich snacks and meals on hand will be super important. And typically, if you're fatigued, you're not going to have the energy to, plan a meal that's going to take out an hour or more of preparation. So kind of brainstorming and planning ahead. Okay, this week I know I'm going to need, this many meals and snacks a day. So this is what I'm going to get. That's going to be just super easy for me to get from the fridge or heat up or whatever. Or maybe you make it all on one of the days and keep it in some containers just that you know that you have to go to. Like I said, keep non-perishable, high-calorie protein snacks on hand. We'll go over some in the next slide. Small, more frequent meals, just like we already talked about. And this is a big one. So encourage activities of daily living and light activity. So I'm constantly telling my patients, encouraging my patients, supporting my patients with physical activity, because it does go hand in hand with fatigue. And sometimes it seems counterintuitive. It's like, well, man, if I'm tired, I don't want to go and do something because that's going to make me more tired. But that's just not that's not how the body works. That's not what the research shows us. That's not what happens in our bodies. So doing, chores around the house, going for not intense, runs or anything like that, but going for walks outside when the weather's nice, just any sort of body movement can actually give you and your mind more energy. And then if you're just really still struggling, we work closely with physical therapists, and I have a lot of love and respect for all the physical therapists that I work with, and think they do wonders for our patients. Getting them on a good physical therapy routine can really, really help combat some of that fatigue and just keep them strong. I mean, treatment, cancer treatment is really hard on your body. And so making sure you're keeping your strength up during this is going to be super important. And the next slide, we'll kind of talk about some easy snacks to keep on hand, like I was saying. So these are just things that I recommend. You guys might have many more great ideas. If you do, I would love to hear them, because I love sharing. I love sharing them with the patients that I work with. I love when you share them with each other. So string cheese, again, these, you can modify these if you're vegan or vegetarian. Cottage cheese with fruit, yogurt with granola and fruit, granola bars, nut butters or crackers, nut butters on crackers or fruit. So I love that one because nut butters are going to have lots of good calories in them. Trail mix. So make your own or just buy the prepackaged. They have some really good trail mixes out there right now that are really calorie dense. And we know nuts have, a little bit of protein in them too. So that's a good choice. Avocado or guacamole with veggies or just with tortilla chips. Avocados have those omega-3s and those healthy fats. Plus they're so calorie dense. So sometimes my patients will, when they're eating cereal, they'll use a protein supplement as their milk. So they're getting that added protein, added calories to that meal, that added energy. Egg salad or tuna salad. That's an example of something you can make on, a Sunday or a Monday and have, in the refrigerator to have, a half a cup or a cup multiple times during the week. Smoothies are a great option to getting super nutrient and calorie dense food all into, liquid form that you can drink. So kind of bulking those up with really, a good amount of protein, fruit. I always do berries, banana, really anything that you like, you can throw into a smoothie. A lot of people that put avocado or they put some kale, because you can kind of really disguise the taste. So they mix veggies in theirs and they're getting all those vitamins and minerals. Milkshakes, if you're going to have a dessert and you have a blender, you could make a milkshake and throw a scoop of protein powder in there. So you're getting some good protein. And it doesn't have to be, a milkshake. It could be an almond milkshake. It could be, you don't have to use milk-based products if you don't tolerate lactose. There's so many great products out there now, oat milk, almond milk, cashew. I mean, you name it, that's out there right now. And all the different, there's a bunch of different kinds of ice cream, just like that. So putting a scoop of ice cream in there too, just, like I said, as a dessert. Protein supplements. There are so many really good products out there right now. As far as protein supplements, we've come a long way from just the kind of standard Ensure There are some really good plant-based protein powders, or pre-made protein supplements, protein bars. Those can be homemade, those can be store-bought, keeping those on hand. Boiled eggs, that's just such an easy snack to get some good protein in you, or cutting up a rotisserie chicken. I have lots of people that'll cut that up on a Sunday and keep it in their fridge, roll it up in a tortilla and have that. I'm always thinking of food safety stuff first too. So making sure you're not keeping that longer than 72 hours in the fridge. Okay, this kind of brings us to the physical activity piece that I was talking about when when I was going over ways to kind of combat fatigue. So the recommendations for physical activity, and this goes for people during cancer treatment as well. So 150 minutes of moderate exercise a day. So that's 30 minutes a day. And then 2 to 3 sessions of resistance training. So that resistance training is what's going to stimulate your muscle mass. So that's recommended. And before you start anything new, I always, want you to talk to your provider about it, because if you have a port or some access that might be affected by any of this, obviously don't want you to do anything that would compromise any of that, but really want you to stay strong and feel good during, after, before treatment, because again, it's hard on your body. So some of the benefits of physical activity that have just been shown time and time again are it reduces the severity of treatment-related side effects, such as fatigue, nausea, neuropathy, osteoporosis, and pain. So we see the more muscle mass you have on your body, the less chemotherapy and medication-related toxicities that you have. And it improves the quality of your life, physical and mental health. And, we know that over and over again. So again, this does not have to be an intense weightlifting, cardio, endurance routine, but some sort of physical activity every day, and then resistance training 2 to 3 times a week. Because what we don't want to happen is the energy balance to shift, and we don't want you burning more calories than you're taking in. But we'll kind of talk about that on the next slide too. But this will be a really important piece of dealing with fatigue and just overall your body feeling better. So this goes kind of hand in hand with the physical activity. So protein, you will hear me. My patients call me the protein peddler. I mean, they have all kinds of things that they call me, because I'm always pushing protein. And it doesn't have to be in meat. It does not have to be animal-based protein. If you are increasing your physical activity, or even if you already are at that kind of, moderate physical activity, and you want to maintain your muscle mass, we want you to increase your protein intake. So protein intake and protein needs dramatically increase during treatment, and dramatically increase with any sort of cancer diagnosis. So your body is going to be burning calories and protein at a much higher rate than before. And so increasing the amount of protein in your diet is going to provide your muscles with that energy. And it's also going to preserve your muscles. So if you are not eating enough protein in your diet, and your body still needs protein for all these different functions that protein has in our bodies, hormones, enzymes, structured function, all these different things, your body is going to get the protein from your muscles, and that can contribute to the muscle loss. So increasing protein in your diet will be really important. So even just keeping, just trying to incorporate it with most meals and snacks would be a good idea. And I just listed out, some of the biggest, the highest protein containing food. So obviously meat and poultry and fish is going to contain the highest amount of protein. So if you can eat those, preferably poultry or fish, limiting red meat consumption to once, twice max a week is good. So for every ounce of meat or poultry or fish contains 7 grams of protein. So if you ate, a piece of fish that's, 5 ounces or 4 ounces, you're going to be getting close to 35 grams of protein, which is really great. Eggs, each egg has 7 grams of protein. And then a half a cup of lentils, dried beans, peas, that actually has 6 grams of protein. So right there, you can see you can get enough protein with those. If you're vegan, vegetarian, or even plant-based, you're just going to have to make sure you're kind of mixing and matching your plant-based protein sources, because with meat and eggs, they provide our bodies with the essential amino acids that we need. So essential amino acids are the ones that our bodies cannot make on their own. We have to get them through our diets. And they are a complete protein. So most meat, poultry, or fish provides our bodies with all of those. With, lentils and grains and beans and some of these other ones, you kind of have to mix and match them a little bit, because if you eat all of the same one, you might not be getting one of those essential amino acids. So just keep that in mind. But typically, if you're eating a variety, which most vegetarian, vegan patients that I work with, they eat a very wide variety of these foods. And so they're most likely meeting, getting all those essential amino acids. A cup of milk is 8 grams. And a lot of those milk substitutes are going to have protein in them now too. So just keep your eye on that. I know oat milk is really low, but some almond milk, cashew milk, they have a little bit lower amount of protein, but they're still going to have some. Cheese, 1 ounce of cheese is 7 grams. So tofu, edamame, 3.5 ounces of that is 12 to 20 grams. So tofu actually is really high in protein. Nut butters and other seeds, those are going to have, depending on, which nut, which seed, and how processed it is going to have 5 to 7 grams of protein per serving. So just keeping that top of mind.
Stephanie, I'm just going to interrupt you because I think I've gotten like 16 questions about how much protein do you recommend per day?
Oh, okay. That's a good question.
And I actually had this same question. Again, we can talk more in the Q&A about this, but
Sure.
Somebody was telling me yesterday that, like, let's say you weigh 150 pounds, that you're supposed to get 150 grams of protein.
No, that's too much.
Insane amount, right?
Yeah, no,
So I was like,
too much.
So talk to us about, like, realistically what that should look like.
So what our recommendation is, and it gets kind of complicated and the math can get a little tricky, because it depends on, we do it in kilograms. So say you're, 50 kilograms, and you're going through treatment right now. Okay. So say you're in treatment, you weigh 50 kilograms. So the recommended daily intake of protein would be 1.2 to 1.5 grams of protein per kilogram of body weight. Okay. Does that make sense? So if you're not
I'm not very good at math, so no, but that's hopefully people.
So that would be 65 to 75 grams of protein a day for somebody that weighs 50 kilograms. Now, 50 kilograms is not very much. 50 kilograms is 110 pounds. Now it gets kind of tricky, because if you're over a certain percentage of your ideal body weight, I have to use an adjusted weight on your protein intake. So again, it can get a little bit tricky. Now, say you're not going through treatment. Say you're kind of maintaining your weight, you're kind of cruising along. You would want to aim for probably 1 gram of protein per kilogram of body weight. Okay. And this is also just kind of a general recommendation. If anything's going on with your kidneys or anything like that, this would be modified, and it would be a little bit more specialized. But in general, I try to aim for, about 1 gram per kilogram of body weight. If you're trying to put on muscle, then that's going to go up. You're going to be aiming for, 1 to 1.5 grams of protein per kilogram of body weight. And so that's when, a lot of my patients that have gotten through treatment and they're like, man, now I just want to get my muscle put back on because I just feel better with it. Okay. I'm going to have them aiming for the 1.5 grams of protein per kilogram of body weight.
And that's a day.
And that's a day.
Okay.
And that's a day.
Okay.
So yeah, everybody's different. I mean, and it's a lot of protein, and can feel like that. And so that's why sometimes when those supplements can come into play, because it's like, oh, that has 30 grams of protein in a supplement, helping you hit those targets. If your targets are really high, if they're not, and you can get it, you can hit those goals just with food, then that's totally great.
Awesome. And some people are asking, what's the conversion from kilograms to pounds? So
Oh yeah,
1 kilogram is about 2.2 pounds.
correct. Yep. So if you
I just
weigh,
Googled it. I'm not that smart.
you
Totally
you got
good.
it. I know. And we, half of us use the metric system and half of us don't. So we in the clinical setting typically are using kilograms. And for this, for any calculations I'm doing like this, I'm using kilograms of body weight. So yeah, so if you weighed 150 pounds, you would just divide that by 2.2 and you would be 68.1 kilograms. And then you could take that and say, okay, I'm actively getting treatment right now. So I'm going to need about, I always calculate a range 1.3 to 1.5 grams, and do the math like that. But I know it can get, the math can get a little tricky pretty quickly.
Yeah. Feel free to finish your presentation, and then there's a lot of great questions. So,
okay. I think this is my last slide. So I think now I'm ready
great.
for all the great questions.
Good. Okay. We have a very well educated and excited audience here today with lots of questions. I'm just going to make sure all the people that said how many grams of protein. Let's talk about constipation. So a lot of our patients experience chronic constipation. Talk to us about constipation management tips. One of the patients takes MCT oil or coconut oil and was wondering if that has any like negative implications for the body, even though it's good at managing constipation, and then just other tips that you have.
So I'll answer that question first about MCT oil. Not that I have seen or read in the literature, does it have any negative side effects, or doesn't put any strain on your organs. It's digested a lot differently than other fats. So that can actually be a good thing. It can actually be easier on your liver. It can be just easier to digest overall because it's not absorbed and digested the same way as other fat. And so, yeah, when we're dealing with chronic constipation, I'm always trying to get to the root cause of it, but sometimes we can't. And so I'll first make sure that you're drinking enough fluids. And fluids, by the way, if you're curious, the recommendation on those, again, it's going to be in kilograms of body weight, but it's 30 to 35 milliliters per kilogram of body weight. And I know these conversions can be a little bit tricky. But so for me, I drink about 2 liters of water a day. And I weigh about 145 pounds. So that's just a good amount for me. So first I'm going to make sure that you're getting enough fluids. Secondly, I am going to have you do a food diary for me, because there are foods that are constipating. So, which oddly enough, some protein containing foods can be constipating. So that is why it's a good idea to get some of your protein through lentils and beans and some of those really good fiber containing foods. So I'm going to have you write me a food diary to see kind of what you're eating. I'm going to make sure you're getting enough fiber though, both soluble and insoluble. And sometimes if those are out of whack, they can be constipating. I mean, if you're eating a bunch of insoluble fiber all day long and you're eating, all your servings of fruits and veggies, okay, and just killing it with that, but you're not drinking enough water, you are going to be backed up. And sometimes it won't matter what we do with our diet. It's the medication or the chemotherapy causing the constipation. So we need something a little bit stronger than just good old fashioned water and fiber to get things moving. And that's when, I have patients that their first line before they go to anything medication wise is prunes or prune juice. Warm prune juice in the evening, or a couple. I always start out on the lower end of both of those because prunes are great. They have a lot of great vitamins and minerals. But they're a natural occurring laxative. So a lot of times it can be, I just want to start off very low and slow with that. But that being said, taking those at night or taking prune juice at night can get your bowels moving. And then if that still doesn't work, then you can go to, you might need some medication, some stool softener, some fiber type supplements that can kind of keep you regular. So that's kind of how I would answer that question. And physical activity. I didn't mention that. Physical activity is great for getting those bowel movements. Coffee, warm beverages in the morning also stimulating your GI tract, can kind of start that peristaltic wave and kind of get things moving through your bowels.
Yeah, thank you. I see one question about that. They take, I'm going to butcher this name, psyllium husk.
Yeah.
For constipation along with water and exercise. Is that okay during treatment?
Totally. Yeah. So that's just that'll be a fiber supplement.
Okay.
Yeah. So that's great. Yeah. So that's not going to interfere with anything, or shouldn't
All right.
Anything.
Let's go to the other end of the gastro system. Diarrhea is what I'm trying to refer to here. There's several questions in the chat about this. One of them, we have several patients who are either on a whole food plant-based diet or trying out a whole food plant-based diet that are wondering, like, if too much fiber from plant-based foods could induce this diarrhea or affect this diarrhea, and if so, how to manage that when they're trying to achieve that healthier lifestyle of eating those plant-based foods.
Right. And that's a hard one too, because which I see this all the time, and I commend it immensely. I do, is like, okay, I am going to make my body as healthy as it can to stay strong during this. Right. And that's such a great mentality, and that's what we want. But sometimes if you're changing things too drastically, or your system is not used to this really high fiber diet, it can increase diarrhea, because it is really hard to digest. It's hard on your belly. So those would be times where I would say, maybe back off on some of the highest fiber foods that you're eating, and see, okay, did that help at all? Let me do that for a few days. If I'm eating, 5 or 6 servings of really high insoluble fiber fruits and vegetables, maybe I'm going to look at that and kind of back down on that, or back away from that, and see, did that help my diarrhea? Because all those plants, all those vegetables and fruits are so good for you. But they make your gut work. But that's why they're so good for us, is because they not only make our gut work, but they feed our gut microbiome, and they provide us all those incredible nutrients. But just remember, if your stomach is really inflamed and angry, and you're like, all right, better get ready to work hard right now, it's not going to be very happy.
Yeah.
And it can go back and forth again between diarrhea and constipation. If you're asking it to digest and absorb all those really healthy fibers, it can get kind of cranky.
I love that, because that allows us to give more grace with ourselves of a slower transition. You're actually helping your body get used to this lifestyle instead of, having to feel guilty that, oh, I'm not doing enough, so hopefully that helps people out there, because I know I've heard that sentiment before.
Right.
So another question regarding diarrhea: can treatment cause irritable bowel syndrome or other bowel diseases that exist after the treatment inducing diarrhea stops? Do you understand what I'm trying to say?
Oh yeah. Can it cause like chronic IBS after treatment?
We have patients that are 2 years out that are still experiencing diarrhea daily. And A, what can be done? And B, is it possible that the treatment caused this bowel problem?
I hate to say I don't know, but I don't know. And I don't want to give information that's incorrect. I could see how it would, I could see how it could. And I haven't ever heard it directly said, okay, this treatment caused IBS, chronic IBS. But I've definitely heard of treatments causing chronic diarrhea, just not ever letting the gut kind of calm down again. In a lot of those cases, when you're dealing with IBS, it is really tricky because you're really trying to target foods that are going to cause you to flare, right? And cause more GI stress than usual. And so that can sometimes, a food diary, a food log, can really help. If I'm dealing with somebody that has IBS, I want to know, okay, 1 hour after a meal, how are you feeling? 2 hours after a meal, how are you feeling? And what did you eat in that meal? And then we're going to kind of dissect that, because most of the time you can kind of narrow it down to, okay, is it these really high fiber, cruciferous vegetables that are causing all this kind of gas and bloating? Is it dairy? Is it, some sort of artificial sweetener? There's a few culprits that can really be identified. But getting to that can take a little bit of time, but really starting to track it and really knowing that, you can do that. You can track it. You can identify it. Your body, kind of how you're feeling and how you're feeling, especially after you eat. And so trying to pinpoint things will be super helpful.
Yeah, definitely. Have you ever heard of Xgeva, bone strengtheners, or gabapentin causing diarrhea?
I have not heard of either one of those causing diarrhea specifically.
I agree. They're usually not the culprit.
Yeah, they're usually not the culprit from what I have seen.
Yeah. Do you have a recommended app on a phone that you would use to take a detailed food history to keep that food diary you were talking about?
Yeah, there are so many great ones now, but some of them are really high tech. So the one that I have had tried and true for, I don't know, ever since apps were kind of a thing, is MyFitnessPal, and it's just a free app on your smartphone, and it has pretty much every food that you could dream of, and it's pretty accurate. So I use that one. I have a lot of my patients use that one. If you want a little bit more detail, because I do have some patients that want to see like all the vitamins and minerals and stuff. There's other ones. There's one called Chronometer, Chronometer, that it's another free app, but it's just a more detailed breakdown of kind of what you're eating. So if you're kind of interested in that, if you're just interested like I am of kind of like the basics, the MyFitnessPal will do all of that.
Awesome. Thank you.
Mm-hmm.
We have several patients asking about, is it possible to eat too much soy protein? And would you recommend a different type of protein over soy when you're given the example of soy versus almond milk, for example?
Okay. That's a good question. So kind of like I was talking about before, if you're plant-based or vegetarian or vegan, those protein sources are not going to be a complete protein like you're going to get if you're eating meat. So you need to mix it up. So don't only eat soy protein. So if you're having, tofu or soy milk, make sure you're getting some beans and lentils and some whole grains, some oatmeal, because those are all going to have a different protein profile. So you don't just want to, just like us, just like I'm a meat eater, but I don't want to just only eat the same type of meat over and over and over, even though, it contains all the essential amino acids. We do want to mix it up because, some meats have more iron than others and, so on and so forth. But yeah, you're going to want to mix up the plant-based protein sources. And is there such thing as too much soy? Not that I've read any literature on. I know last probably 10 years or so ago, there was a lot of literature out about soy and breast cancer and kind of a lot of misleading information, but everything we've read and looked into, soy is safe. But again, you're not going to want to just have that as your sole source of protein. You're going to want to mix it up and eat a variety of different plant-based protein sources.
Okay, awesome. I'm getting lots of questions still about like converting things. And honestly, you would be doing what I would do, which is Google. So just use Google as your friend in trying to find different conversions. I know it's difficult because this is a national, like international
I
group, so
know.
we all use different things. And
I know.
I'm so this is not my area of expertise, so Google is a good friend in this
And
case.
always remember too that everybody's body is different. So my protein requirements for what I do are going to be different than yours. And also if you're Googling it, make sure you're looking at, if you're looking at conversions, make sure that you are looking at protein requirements during cancer treatment, because those
Yeah.
are going to be, increased from if you're not going through that treatment.
Yeah, definitely. All right. How can you increase calcium if milk and cheese products are not good to take during induction therapy?
So calcium containing foods. I know, and the highest calcium containing foods are going to be milk and dairy. There are a lot of supplements out there though, not just like pill form supplements, but like nutrition supplements. So they can be plant-based protein supplements that have some of them will even have your daily recommended amount of calcium in them. They'll have, whatever, 75 to 100% of your daily recommendation of calcium. Off the top of my head, let me,
I know broccoli
because I have
has.
I have a calcium handout that I give
Okay.
that I love. And I know everybody's disappointed if they're not tolerating lactose because it's a lot of those kind of foods. Tofu is another one. Yeah, I forgot about that. So tofu is going to have some calcium. Oranges or citrus containing foods, cruciferous vegetables. So broccoli, cauliflower, Brussels sprouts, those are going to have some good calcium in them too.
Okay, awesome. There's a couple more questions. I want to get through as many as we can. I know we're ending. Do you have like 5 more minutes?
Oh yeah, no, I'm good. Yep.
Okay. So Kathy's saying her husband suffers from fatigue, but is also gaining weight and feeling bloated from the decks. I hear that all the time.
Me too.
Is hesitant to eat high calorie foods for the fatigue because of the constant weight gain from the steroids. So what ideas do you give to patients that are in similar situations?
So I will have them focus on the protein more than the calories. Okay. Because that protein is going to be feeding their muscles and maintaining their muscles, which is going to in turn give you more energy. So calories and protein are both important, but if somebody, and I see it all the time too, that DEX, I mean, you do get very bloated and uncomfortable, and there is, weight gain associated with it. And it's typically not, the weight gain that you want, because you're not gaining muscle mass. So focusing on that protein intake and a little bit higher protein intake can help gain muscle mass while cutting down on some of that fatigue and bloating.
Yeah, that makes total sense. How helpful are protein drinks like Boost and Ensure? Do you regularly recommend these?
I do, especially during treatment, and it doesn't have to be Boost or Ensure. There's a lot of good products out there right now. It's kind of whatever is preferred by, I mean, I have a ton of options here that I have patients try, because there's a lot of really good plant-based products right now that have some good fiber. So they're more like real food-based supplements that I really like to recommend. But I do recommend those because it's sometimes it is hard to meet your protein or calorie goals when you're combating some of these GI side effects. So when you think of 350 calories and 20 to 30 grams of protein and 8 fluid ounces, I mean, that just packs a punch, right? And so it just is appropriate. And, everyday life, do I think everybody needs to walk around drinking protein supplements? Not necessarily. But I think they're definitely indicated, especially with those increased protein needs. But you could also do protein powder. I have a lot of patients that they cannot stand those protein drinks. So they'll get protein powder and they'll add that to their oatmeal or their cream of wheat. They'll add a scoop. It's the same. I mean, it's the same thing. And so finding different ways of using that protein powder rather than the actual pre-made protein supplement can be helpful as well.
Yeah, definitely. What about whey protein powders? Is that something you recommend?
So whey protein, if you digest it well, is the most bioavailable proteins, meaning that your body digests it, absorbs it, and knows what to do with it. It's kind of that complete protein profile, like I was talking about. But some people do not tolerate whey well. Some people, it causes a little bit of bloating, upset stomach. So I will always have people try whey. Typically, if you do okay with milk, with lactose, with dairy, you'll do okay with whey. If you don't, I would stick to more of a plant-based protein powder, which there's just so many of them out there right now, and they make them a complete protein. So those are just as good.
Yeah. Talk about probiotics for a second. Do they have intestinal side effects, like the supplements?
Yeah. So I know this is a really hot topic right now too. I get this question all the time. So we don't recommend the pill form probiotics during or immediately after treatment, just because it's introducing an unregulated bacteria. So these supplements are unregulated. So I can't guarantee exactly what kind of bacteria you're taking when you're taking that. Now, I will say food form probiotics and prebiotics are highly, highly recommended. And those are in the food that, those are going to be in yogurt, those are going to be in sauerkraut and kimchi and all of those. And those are FDA regulated. So we know exactly what's in there. And those have all been shown to have great gut benefits. And so I'm always encouraging the patients that I work with to increase their food form of probiotics. And then prebiotics are the food that are feeding those good bacteria. So the probiotics are the actual bacteria. The prebiotics are
I hate that it's so
I know it should be. I know I know. And so some of those are like garlic and onions. A lot of vegetables are great prebiotics, but yeah, increasing those in your diet before jumping to the supplement form of probiotics. I do have patients that eventually we do trial on a probiotic supplement just because their GI symptoms really don't improve by increasing their dietary probiotics. But that's something I always want to try first because our guts just prefer it. I mean, that's what they were built to do. They want to digest and absorb and populate that gut microbiome. So food first.
Yeah, definitely. 2 more questions here. Are fiber chews good to use if you can't tolerate xylem? I'm not sure what's that.
Oh, the psyllium husk.
Oh, so probably.
Yep. So fiber chews, I haven't worked with them a ton. But I would say if you don't tolerate the drink, it's usually a drink. Sometimes it's a pill form, of the fiber supplement. It would totally be worth a shot. I don't see why those would be contraindicated at all.
Okay. Lots of thank yous from a lot of people. They really enjoyed this session.
Good.
Last question, excuse me, is does eating frequent small meals contrast with the migrating motor complex, which suggests letting the stomach empty between meals?
Right. Well, and that's kind of a different way of thinking. And that kind of comes back to what I've been talking about, which is everybody's body is different. So some people, their gut feels best when they wait those, 3 to 4 hours between meals. But typically what we're seeing is if you're having some of these GI issues and you're having chronic fatigue, keeping something in your system every 2 or 3 hours, it does actually add a lot of benefit. But I will say that I've seen, everybody's body is different. So I have patients that they feel better when they give their GI tract a little bit of a break. But then I have some patients that if they give their GI tract a break, they're throwing up. They are, they're sick. So I would just say I would play around with it, and anything that you find is beneficial to your body, I would totally roll with it, and I would 100% support that.
Awesome. Thank you so much, Stephanie. I really appreciate you and the time that you took to prepare for this and just present and answer questions. You did an excellent job. So
yeah, well, I'm glad to be here. Yeah. Thank you guys
and you delivered.
Yes. Well, I would be happy to come back if you guys ever want to hear from me again, but it's something I'm super passionate about. And again, I love it. And I love walking with people through this journey. So anytime.
Okay, thank you.
Yeah.
And a feedback survey is given to you as you leave Zoom today. Please make sure to fill out that survey. It's 2 to 3 minutes. Stephanie and I would both appreciate the honest feedback from how you enjoyed this session. Please meet with us next month in October. The date is TBD because I'm still securing a speaker, but several of you have asked that we talk about the microbiome or gut health. So we're going to have a microbiome 101 session to learn more about gut health and how properly fueling and feeding your microbiome can help change your perspective on how you take care of your body. Other events, September 13th, we have 2 more events. At 7 p.m. Eastern is our relapse refractory chapter. We're going to be talking about pomalidomide. At 6:30 p.m. Pacific, which I know is confusing with all the time zones, but it's our Southern California regional chapter. We're going to be talking about equity and advocacy, why it matters and what we can do together. And then the 14th at 1 p.m. tomorrow is our stem cell transplant chapter. We're going to be hearing about the true cost of a stem cell transplant and different factors to consider. The link to sign up for any of those events, even more events I haven't mentioned, is found at the bottom of the slide and will be included in that follow-up email. Another thank you to our sponsors, Bristol Myers Squibb, GSK, Genentech, Janssen Oncology, and AbbVie, and a big thank you to each of you for helping us build this nutrition and wellness community. We appreciate you and hope that you have a great rest of your day. Thank you, everyone. And thank you, Stephanie. Take care.
Thank you, guys.
Bye-bye.